First tonight, when it comes to masks in schools, the governor is doubling down. He says students shouldn't be forced to wear masks.
Parents obviously can equip their kid to go to school however they want, but there shouldn't be any coercive mandates.
But as COVID cases surge in the state, some doctors are questioning his pandemic response, and they want the governor to focus more on the vaccine. Fox 13's Aaron Mesmer is joining us now live in Tampa. And Aaron, take us through these physicians' concerns today and what they said.
Yeah, Kelly, we've heard the governor over the last few weeks talk about several different topics, but these three doctors who participated in this virtual meeting today want him to focus primarily now on COVID-19 again. They don't think the governor is doing enough to slow the spread of this Delta variant.
Every conversation should be about COVID right now.
COVID-19 is surging again. Healthcare workers find themselves back on the front lines, and at least three of them, including St. Petersburg immunologist Dr. Mona Mangat, feel Governor DeSantis isn't doing enough to help.
So this is the time to double down, get back into the business of this, and stop politicking around and start doing some real science and saving lives.
Mangat, along with Dr. Bernard Ashby, a cardiologist in Miami, and Dr. Frederick Southwick, an infectious disease specialist in Gainesville, held a virtual news conference Thursday. They say vaccine confidence is in desperate need of a boost.
They don't trust the vaccine. They don't trust what we're saying about the vaccine.
And while the governor has consistently urged the public to get vaccinated, these doctors feel the message gets muddled. They believe DeSantis' sharp criticism of Dr. Anthony Fauci, the nation's leading infectious disease expert, his cruise line lawsuit against the CDC, and his public criticism of national efforts to slow the spread are exacerbating vaccine hesitancy. The governor fired back. He says the vaccines are available and free for those who want them, and he maintains he has no plans to order any further shutdowns or COVID safety precautions like masks or social distancing.
And it's easy for some physician to advocate that because it doesn't affect them. It does affect the people in this state. So we're going to lift people up. We're not locking people down, and we're going to make sure that folks are able to exercise their decision making.
And while these doctors are urging DeSantis to take the message to as many corners of every community as possible, the governor says that's exactly what he's been doing.
Were you asleep in December, January, February, March when I crisscrossed every corner of this state? I showed up at nursing homes. I showed up at hospitals. I showed up at senior community.
But Dr. Mangat wonders why he isn't doing that right now.
You know, the governor's talking about all sorts of other things when this is the pressing problem and the one that's most life-threatening to Floridians right now. So conversation needs to shift back.
Just recently said he also believes that this is a seasonal spike in COVID-19. You may recall this exact same time last year was when we saw another big increase in COVID-19 infections. But the doctors who participated today took issue with DeSantis, saying that they do not believe this is a seasonal spike. They say this increase, Kelly, in COVID-19 infections is related directly to the spread of the Delta variant.